All right, so thank you for taking your time to come be with us this afternoon. During this meeting, we're going to have a discussion about the health and safety technical assistance needs related to COVID. We're also going to discuss the governor's executive order and the recent changes to the Child Care Strong NC Public Health Toolkit, what you guys refer to as the health and safety guidance. And we're going to discuss how this information is affecting your program. The meeting time is expected to be 1.5 hours, and training credit will be given to everybody that came today, as long as you saw it live. We are going to share a recording for anybody that is not able to be here today, but they will not be able to receive training credit. Please note that your microphone should stay muted. If you have questions or comments, you can put them in the chat box. We have Erin Pickard here, and she is going to try to keep up with your questions. If we're unable to answer all of your questions, we will follow up with an email after. And before we get started, as a practice opportunity for using the chat box, we would like you to think about this last year. Specifically, any major concerns that have occurred due to COVID and any positive changes that have been made to keep your facility healthier and safer that they will continue to use at the facility. So if you can think of anything you've changed or improved to keep your facility healthier and safer, can you type that into a chat box? And that will give you practice. Make sure everybody knows where the chat box is. And I want everybody to know that if we get disconnected for any reason, go back to that original link and just log back in. It might take a time or two just in case, somebody's internet goes out, or even mine. Just use that same link to log back in. At the end of this training, you will have a SurveyMonkey to complete. I'm going to put it in the chat box. If you're unable to do the link, just say that in the chat box and I will try to email it to you. I know this technical stuff can get very, very tricky. With us today, we have myself, and I'm from Smart Start Rowan. I'm Jamie Gualiano. We have Carolyn Conley from DCDEE. She's our child care consultant. We also have Teresa Mowry from the Rowan County Health Department, who a lot of you have been talking with. And I'm going to hand it over now to Carolyn, who is going to start this presentation.
Hey everybody, I think it's Thursday. Happy Thursday, and I want to thank all of you for attending this Zoom. I know all of you have crazy schedules and wear very many hats and don't know which hats you're going to wear every day. So I do appreciate you taking the time to meet with us. A lot of information, and we just thought it was important that we took the time to share some of the information with you, since it is constantly changing. So I'm going to go ahead and get started. And the first piece I'm going to talk about has to do with the executive order. And basically, this executive order is coming from our governor, and that we must adhere to all the requirements. And this last executive order, the most important thing that pertains to you has to do with that all our children 5 years and above must wear the face coverings. Now that is something new. So that means even your preschool age 5-year-old should be wearing the face mask when they're in your facility. Now, in that executive order where that statement is, it also states unless an exception applies. So I have had a couple of questions about that some have shared with me that they have a parent or a legal guardian that's coming in and says that their child has an exception and does not need to wear a mask. And the question that's been posed to me from some of you is, do you need a doctor's note? And the answer is no. That parent or legal guardian does not need to give you a doctor's note if they're stating that their child is meeting one of the exceptions. Now the exceptions are listed in the executive order, and it's on page 10, and it's under 2.4. So under 2.4, there's a list of exceptions, A through K. So if you have a parent or a legal guardian that's coming to you and saying that their child meets one of those exceptions, then you are to adhere to that. Because at the bottom of the list of exceptions in the executive order, it states, anyone who declines to wear a face covering for these reasons should not be required to produce documentation or any other proof of a condition. Okay, so we want to make sure that all our children 5 and above do have those face masks on. If you have parents stating that their child has an exception, then you need to respect that, and you are not to ask for a doctor's note. But I would suggest just reminding your families and legal guardians the importance and the reason why the children should be wearing the face mask. So that's the biggest piece on that executive order that really pertains to our profession, is the difference with the face mask. Does anyone have any questions about that concerning the executive order? And if questions do pose, just like Jamie had said, please make sure to add them to the chat box so that we can get a chance to get those questions answered. And if we don't during this, that we can get an email out to everyone. So the next piece is the overview of the Child Care Strong Public Health Toolkit. And this is our guidance that we have been receiving since May of 2020 when all this came about. And this document is constantly being revised as well. And normally you see the revisions come when the executive order has had revisions. So with this toolkit, I know you all see that there's things in there that say recommendations, and then there's things that say requirements. So basically in that toolkit, everything that's in there is based on what's in the executive order. So the actions that are required are identified in the executive order or in our child care rules. And then there are actions that are recommended. And they were recommended to, of course, to protect people in a child care facility to minimize the spread of COVID-19. Facilities are expected to meet every effort to meet all guidance in this document. However, it is understood that some of those recommended actions may not be feasible to all settings. So the recommendations in there, we do want you to do your best to follow those recommendations, but we do understand that some of those recommendations may not be feasible for your facility. But the statements in there that say they are requirements, you are required to meet those. So the last time that toolkit was updated was on December 10th. So I'm just going to go through the items that have changed as of December 10th. And I know that Teresa has been doing a great job as far as sharing that information with all of you as well. So again, the biggest change is the revised requirement concerning the face coverings, that all children ages 5 and older should be wearing a face covering. And that can be found on pages 7 and 12 of the toolkit. Another change that has been made is the requirement to follow the latest Center for Disease Control guidance regarding quarantine. That can be found on page 4, 16, and 19. And in a little bit, we're going to talk more about quarantine. The other piece that has been changed in that toolkit is it now allows regulatory agencies and consultants providing monitoring of health and safety practices and offering technical assistance to enter your facilities once we're screened. That's on page 6. And at the end of that statement, it says once screened. So just like when you're screening your children, with the temperatures and the health screening questions, anytime any of us, anyone comes to your facility, you need to do the same to us as you do with your children. We want you to take our temperature. We want you to ask those health screening questions. Another thing on page 6 that has changed, it clearly defines stable groups of children and adults, which are cohorts, to minimize the extent of exposure. So basically what it means is you're keeping the same children and the same staff in the same classroom. Okay, so we also know that that's a challenge. We know, especially in the beginning of the day and at the end of the day and during breaks, but you want to do your best to make sure you have the same children, same staff, and the same classroom to prevent the spread of COVID-19. And this is so important because when you start changing staff or children into different classrooms, if you had a child or staff in one classroom that may be a carrier or is positive, and now they're going into another classroom, then that whole classroom has been exposed as well. So it's real important. You know it's a challenge, but it's still important to make sure you have the same children, same staff, in the same classroom. So that's a big one on page 6. Now the other piece that has been added, it starts on page 20, and it's a glossary of common terms that are used, okay? And one of the terms that they talk about in there is the term quarantine. And remember what quarantine means. It refers to an individual who has been in close contact with someone that is positive COVID-19. And with that person is considered to have been in contact with that person if they have been around someone that has tested positive for at least 15 minutes within 6 feet. So any person that's been within 6 feet for 15 minutes with someone that is positive, that person will need to quarantine, okay? Now, CDC continues to recommend that quarantine is for 14 days after last exposure. But as of December 2nd, CDC has offered options to reduce the duration of quarantine in either of 2 scenarios. But before I go through those 2 scenarios, I do want to bump down to where it says, local public health authorities make the final decisions about how long quarantine should last in the communities they serve, based on local conditions and needs. So here in our county, Rowan County, they still are, their final decision right now is still 14 days of quarantine. So even though I'm going to review the 2 other options, Rowan County Health Department trumps those 2 options as of right now, okay? So CDC, one of their options is 10 days of quarantine. Someone can have 10 days of quarantine if they completed the 10 days and have no symptoms and have been reported during daily monitoring, okay? The other is 7 days of quarantine have been completed, no symptoms have been reported during the daily monitoring, and the individual received results of a negative antigen or the PCR molecular. So the antigen is the rapid test, and the PCR molecular is the one that normally takes a couple of days. And the test that they can take the test no earlier than day 5 of quarantine. So that's the 7 days of quarantine. They've gone 7 days, no symptoms. They've gotten either the rapid test or the other test no earlier than 5 days of quarantine, and the test came back negative. But as I said before, CDC continues to recommend the 14 days after last exposure, and our Rowan County Health Department, their final decision is, as of right now, it is still required to have the 14 days of quarantine. And that basically that is just for the safety of our programs. A lot of information. So basically those are the items that have been revised in the toolkit that came out on December 10th. Okay. Now the other piece I wanted to mention is the Department of the Public Health is now developing more resources for child care facilities. They have created a work group, and in that work group, they brainstorm ways to guide providers with disinfecting better and for better ventilation in the facilities to prevent the spread. So right now they are devising kits that will be sent out to all of you, And in those kits, they will consist of spray bottles for bleach solutions, microfiber cloths, infographic fact sheets, and other resources related to disinfection and ventilation. It's not been determined how these kits will be distributed across our state, but we'll keep you posted on that. They did mention, though, that they are planning a webinar sometime in February that will include information about disinfecting and proper ventilation in child care facilities. And at that time, they should be able to share with you as far as how and when you'll be able to get these kits out to your facilities. One of the other things that they are developing too is an infographic sheet for families. So basically safe cleaning for families as well, and to keep their homes safe. But I do want to mention on that DCDEE on January 19th also sent an email out for information for your families that you can share with them. And that was coming from the North Carolina Child Care Health and Safety Resource Center. So again, that email went out to everyone on July 19th. And there's some great resources there for you to share with their families, because we all know you all are doing a great job of as far as sanitizing and cleaning and keeping it safe for the children that you serve. But we also need to educate our parents on how important it is that they do that at home as well. Any questions? Now, the next piece has to do with technical assistance. And all of you now are aware that all consultants with the Division of Child Development and Early Education, we were able to begin annual compliance visits effective September 15th. As of September 15th, we all were trying to get facilities that have not had their annual compliance visits, get them so they're not delinquent, and also get caught up with the ones that were coming up. So it's been a crazy couple of months. But also while we've been out in facilities, we have found several programs that are not adhering to what's in the toolkit. And probably the main components that has a red flag for us is the health screenings, and making sure that not only, like I said earlier, not only are they being done with the children and families, but they are being done for us as consultants when we come in, or any other adult or any other regulatory agency person or therapist, anyone that comes to your facility, that you're making sure to take their temperatures and then also to ask those health screening questions. So we had to share this information with our main office, wanting to know what our concerns are. And so we can make sure that we are providing the technical assistance and resources and support that all of you need. So with that said, while we continue to limit the number of people in facilities, we do want to make sure that TA and support for health and safety is available for you during this time of the COVID-19. So there are times that as a consultant, I may come in and I may ask you, if I see concerns, like for example, I've seen staff wearing masks, but they don't have their face and nose covered, or seeing children arriving and the temperature being taken, but the health and safety questions are not being asked by the parent. So I may ask, hey, would you like some technical assistance? Teresa's available, and a lot of you, Teresa's been doing such a great job, have said that she's already been in contact with you, you have her personal phone number, and that she's been available for you for support. But we will be referring programs if they need the help. If you choose not to want that help, that is okay, but it will be offered at times when there might be some red flags as far as following the health and safety guidance. So with that, I am going to open it up to Jamie and Teresa so they can talk a little bit about what technical assistance they can provide for all of you.
Teresa, I can let you go first.
Okay. Thank you, Jamie.
Mhm.
I think most people know that they can reach me by phone, and the health department had asked that we not go out while the child cares were under lockdown. So I haven't been providing on-site. That may soon change, but I'm certainly available anytime you have questions. I can guide you through the toolkit. I can tell you what the health department's recommendations are, because I do know we've had some questions over the 7 and 10 days. And due to the number of cases, the health department made the decision to maintain the 14-day quarantine period. So I'm available if there's anything in particular. Hopefully, if I'm allowed to start coming into the centers, if there's something particular that you want to have some training with, then I'll be able to do it at that point. But in the meantime, feel free to call me at any time. Like I say, I've given my personal phone number because most of you know I don't work on Friday. I'm a 32-hour program, but you're more than welcome to call me on Friday with any questions.
Yeah, I know that most people, when it comes to like something specifically like a family having COVID, they're coming to you, Teresa. But we are going to start something and have it regularly so that you guys can always have your questions answered, even if they're not specifically COVID related. We're going to have 2 sessions every month, one nap time session and one evening session. When I say we, I'm referring to Smart Start Rowan. And this is going to be an open Zoom link, 1 hour. You don't have to be there the whole time. You can pop in, ask your question. If you need a private meeting, feel free to ask for one. You can come to this meeting and ask for your private meeting. The first session is going to be on February 9th from 12:30 to 1:30. The second one is going to be an evening session from 6:30 to 7:30. And these first sessions, Carolyn is actually going to attend with us. So it won't be just me. So if something changes with the guidance and you want some clarification on it, if you don't understand something they said, or you don't know how to do it exactly the way that Carolyn wants you to be doing it, then these are the times and meetings that you need to show up at. And we're always here virtually, by phone, by email. I know sometimes I have email issues. If you're having email issues with me, just call Smart Start directly. And that always seems to work, and we're able to get it worked out. I guess I can give it back to Carolyn now.
Thank you, Teresa, and thank you, Jamie. And I want all of you to know that Teresa, Jamie, and myself, we do keep in communication, and we are here to support you and help you and to provide resources. So if at any time there are any questions, we're here for you. You just need to reach out. And as Jamie had said, that you know, the 2 meetings that she has coming up, I will be there. And hopefully any others that she has coming up, that I will do my best to be able to attend. And I think it's important, I think it's a great idea too that Jamie is doing this, because you know, we are limiting our time in the facilities because we want to respect what you have in place to provide a safe environment for the children. But we also don't want you to feel that we're not there to support you. So I hope you take advantage of these meetings that Jamie does have set up. And you know, we're just here to support. We know this is crazy times, and we know it's stressful, but you're not out there alone. So we just want you to know that we're here. Now, I know that Jamie had sent an email out as far as if anyone had some questions, and I know I have had a couple, so I'm going to address some of those, and then I think Teresa has one too that she wants to talk to you about, but I'll go first. I do want all of you to know that right now there are some flexibilities concerning required training. And that has to do with some virtual trainings that are available and will be available until June 30th, and they will count towards your requirements. And those trainings are the ITSID Safe Sleep, the EPR training, and the playground training. So those are 3 trainings that are offered virtual right now that we will count until June 30th as of right now, because we know that there are folks out there that need these trainings, and we know that they may not be offered in person. So we want to make sure that everyone is up to date with their ITSIDs. Any new folks that need their EPR are able to get it, and any new folks that need that playground safety training that they're able to get it. So those are 3 virtual trainings that are available that you can use and will be counted at least until June 30th. Now, another question that's come up a lot, and I do want to address, is concerning Play-Doh. Now, in the guidance, it's recommended that Play-Doh not be used. And in the past, there have been times that it was discussed that Play-Doh in separate containers labeled with each child's name may be used as long as children are washing their hands prior, they're washing their hands after, and that you have the teachers right there and they're monitoring that. Well, that is no longer. Play-Doh is not to be used in the classrooms. Basically, we don't know if it's considered a petri dish right now for COVID-19. If a child sneezes or if a teacher turns their back for a second, another child touches the other child's Play-Doh. There is an exception, and that has to do with children that have an IEP. And if in that IEP, it states in there that for to benefit that child, there will be Play-Doh involved. That will be allowed, but that Play-Doh would need to come in with the therapist and go out with the therapist. So, and I'll probably send an email out to everyone concerning that, because I know some of you that may have had that question may not be on this meeting right now. So again, no Play-Doh unless it's part of the IEP and it's coming in with the therapist and it's going out with the therapist. Trying to think if I already talked about the doctor's note. That was the other question I had. If you were able to request a doctor's note if a child cannot wear a face mask. That also pertains to staff. If you have staff that are stating that they cannot wear a face mask and they meet one of those exceptions on 2.4 on page 10 of the executive order, you cannot request a note. But just make sure if you do have staff that that cannot wear a mask, ask if they could wear a shield, one of the face shields. Make sure that they are keeping safe distance and keeping that 6 feet. And if it's not within that 6 feet, that it's less than 15 minutes. Let me see, let me just double check to see if there are other questions that I have had. One that did come in had to do with the environment rating scale assessments. Right now, all that's at a halt. Assessment stopped beginning of March of 2020. So you think of everyone in the state of North Carolina that had assessment scheduled, they have been put on hold. And then, so at this time, we're not going to worry about the assessments right now, making sure if you have staff and they have their education, making sure all that's in works. But as far as the assessments, we have no word right now as far as when they will start up again. Many reasons. One, we want to limit, making sure everyone's limiting the amount of time they're spending in your classrooms. And two, if the assessors were to come out, it's not going to be a true picture as far as what your program looks like because of all this health and safety guidance. So I just want to tell all of you that have your rated licenses coming up or the rated licenses that have been put on hold, just breathe. And as we get information, we will make sure to share that information with you. Don't fret if you're over your 3-year period. again, once we find out how to proceed, we will make sure to share that information with you as well. But we don't have any time frame. We don't have any date as far as when the assessments will begin. So we're just going to take one day at a time. You will see me during annual compliance visits, as most of you have already know. But as far as the rate of license process, we're just going to put that on a back burner for right now. But I know all of you are making sure that you are following all the rules and regulations. We all know with the environment rating scale that should be going on in your classroom every day. So you're doing what you need to be doing, then just keep on doing that. But as far as the rate of license process, again, put it on hold, and as we get information, we will make sure to share that information with you. Now, Teresa, did you want to share?
Yes, a couple of points. One, the 15-minute period is a cumulative. It's not just a straight 15 minutes anymore. The CDC changed that, and it's cumulative. As long as it's 15 minutes, you're within 6 foot for 15 minutes within a 24-hour period, and that can be cumulative. A couple of minutes here, 5 minutes later, as long as it totals 15 minutes, then that is an exposure. The other thing is the toolkit doesn't say anything about asking on the health screening questions if anyone is waiting on a pending test result. And we have had centers impacted by children who have been brought only later that day to find out they're positive. The parents were waiting on the test. The toolkit is giving you the minimum guidance. You can go more, but this is the minimum that you need to do. So I've got some centers who are talking about adding that to their daily screening to ask if anyone is pending test results, because we have had classrooms have to close down and centers where children were not kept separated because someone later that day found out that they were positive and the parents were not asked, or the school did not know that they were pending a test. So you might consider that and let your parents know you're going to ask that, so that if they are pending a test, they might need to keep that child home at least until they get their results, so that you don't end up spreading that to exposing the entire classroom and having to close it down. Any input on that topic, Carolyn, you want to add?
No, but thank you for mentioning the cumulative. That is something new, and so I hope everyone's clear on that. It's not 15 minutes straight, it's 15 minutes within a 24-hour period. And that was a huge change. Thank you for clarification on that, Teresa.
Oh, you're welcome.
Jamie, did you have any other questions that came through or anything you want to add?
No other questions, but I do think it's really helpful to, well, we just had some. Okay, Cassie asked, I have a question about the sensory play. If a child has their own sensory tub, can they still play with other sensory items that are not Play-Doh?
What kind of sensory items?
Cassie, you can unmute yourself if you want, if you'd rather just talk.
Okay, so I was just wondering, because we have, like, for instance, like instant snow, like our children in our classrooms have like those individual containers with the lid that has their name labeled on it that they may put like instant snow in, and each child has their own container with their name labeled on it. And when they're finished with sensory play, they sanitize and wash it out, and it's put up until the next thing. So that's why I was wondering if that was still okay, because I know we we've been kind of confused on which way is the right way to do it.
Now, when you said, so when after the child is done playing with the snow is thrown out, and then
Correct.
it is. So it's disposed of once that individual child is done with it.
Correct. So that each individual, like say for slime, for instance, they make the slime and then each person gets their own bucket of slime. When they finish with the slime, they throw everything away, rinse out the containers and sanitize. And then they may create another one for the next week or next day, whenever they do it again.
And when they're using this, are staff right there so they're able to monitor to make sure that the children are not going into their friend's container?
Yes, ma'am.
Okay. I would say that is okay as long as you have staff that are standing right there and it's disposed of as soon as the child is finished with it.
Okay, and if they throw away the Play-Doh after it's used one time, is that okay, or Play-Doh is absolutely no-go?
Cassie, that will be one. Let me get some clarification on that, because I don't want to say yes and then find out no on that. Erin, if Erin Pickard's on here, she's our lead consultant. I don't know if she might be able to add to that.
I just know that they said strictly no Play-Doh, so I would say no. They don't want anyone playing with Play-Doh, but I don't know that wouldn't apply to all sensory materials like that the same way. So we probably need to get clarification on, because I don't know why Play-Doh would be any different than what she was explaining.
Yeah, other than
to have their own bucket and then throw it away at the end. I'm not sure that they want them using any kind of sensory material like that right now.
So Cassie, let's hold on to the snow and let me get some clarification on what they can and can't use as far as sensory.
Okay, and I know that you guys, because we have a lot of children with special needs, and so a lot of them need sensory play. So I know that you said that if it was in their IEP that it could be accepted. Do I need to, if that is the case, I need to make sure that I have their IEP if you guys come that says that?
Well, yes. And usually is the therapist normally there?
They're only here, I'm sorry, they're only here one day a week for at max an hour.
Okay.
So their therapy goal may include like fine motor skills, use Play-Doh to do blah, blah, blah. That's the biggest concern for us, is that we have so many children with special needs that are sensory seeking that it's causing behaviors that they don't have an alternative to look
right.
for in another way.
Yeah, let me get clarification on that and see if you would need to have the IEP there. I'm thinking you would, because you would need to have the documentation. But let me see if I can get more clarification. I'll email everyone out what we find out.
Okay, thank you.
Carolyn, we also have a question from Norma. And Norma, if you want to unmute and just ask your question about walking the children, whether it's a requirement or a recommendation.
Jamie, I just answered it for her, but on page 2 of the toolkit, you can see that it states that it's a recommendation that staff greet children outside when they arrive, and that a designated staff person walk the children to their classroom. So it's still listed as a recommendation at this time.
A recommendation, not requirement right now. Thank you, Erin. I was just going to point out, for anybody that didn't read in the chat box, the original question of what are some of the things that you've done to improve your health and safety during COVID-19 that you have actually found to be positive. I think these are good to share, because it might give somebody else an idea of something to add to kind of ease these, new requirements. And some of them are pretty interesting. Norma said misting. Robin said controlling the traffic inside the facility. So she's looking at the positive. You know, there's not extra people coming in the facility. Let's see. Cassie said the digital screening assessments, which is great instead of the paper version. Beth said using the mister every evening for the classrooms and sanitizing all the doorknobs multiple times throughout the day, which is a great idea. And honestly, and that's probably cutting down on other sicknesses like strep and the flu as well. There's, you know, some positive things about learning about sanitizing surfaces that have come out of this, even though it's been difficult. Alicia said daily screening for not only staff, but families as well. And Shara Dearman said, we have added an electronic temperature taking kiosk that is hands-free. That is pretty interesting. I would like to see what that looks like. Patsy said, by moving our sign in and sign out sheets to the outside area and keeping our doors locked, so no one other than staff is inside and everyone getting their temperature taken upon entering the building. Katie mentioned never mixing the groups of children, and I love this one, lowering classroom sizes. That is definitely a positive for the children in many ways besides health and safety. I think that's it for the positive suggestions. Sometimes it's hard to come up with something positive, but I see those all as very positive in more ways than just health and safety. Kimberly said we have a drive-through service with the same employee located outside in the morning to screen children and bring them in. Oh, I like that. That's like what the public school does. Drive-through service continues in the afternoon with an afternoon staff member walking the child out. I like that. That's very good, Kimberly. And I think those are good to share because if you're maybe struggling with the way you're doing it right now, somebody else might feel inspired by the way you guys are, you know, figuring out ways to meet these new requirements. I like that, guys. Good job.
So what I have in my notes, I just want to make sure that I have, so the only thing right now that we need clarification on has to do with sensory play and how to handle that, and what can and can't be used for sensory play, if it's being thrown out and the containers are being sanitized and cleaned. And then also if it's in a child's IEP, does that IEP need to be there on site and for our review? Was there any other questions that we were unable to answer? We needed clarification. No? Okay. Any other questions? So right now, what? Go ahead. Jamie, were you gonna say something?
Yeah, there's just nothing else in the chat right now.
Okay. So right now, I do want to take the time to thank Teresa and Jamie for being here for supports, and especially for Jamie for putting this Zoom meeting together and taking care of logistics with it. And again, thanking all of you that attended this today. We know you all have busy schedules, and just want to let you know I'm so thankful for all that you're doing for the children and families that we serve, and how hard all of you are working to make sure that this is a healthy and safe environment for the children, and that the parents can breathe knowing that their children are in a safe place. I know it's not easy, and kudos to all of you for always being there for those children and those families. And I want you to know that we're here for you for support, for technical assistance. Just reach out to us. And we all hope that the information resources shared today were helpful as you continue to navigate providing that quality childcare during this crazy time. And DCDEE, we're always here to support you in any way we can, but we also want you to know and be aware that DCDEE, starting in March, we will be citing violations if the health and safety requirements are not being met. Basically, those requirements, again, are what are in that health and safety toolkit. And after almost a year of this pandemic, we have to ensure accountability for these requirements. And if you have any questions that weren't answered during today's presentation, please reach out to us. And as of the violations that will be cited starting in March, I'm not sure what that will look like, but any other information that I receive, I will make sure to share with all of you. The contact screen that Jamie has up right there, it has my phone number and email. Chris Updike is my licensing supervisor, and that's her phone number and email. And then you have Teresa's there and Jamie's, and I'm sure you probably have all that already, other than Chris's. Does anyone have any questions?
Carolyn, I do want to add to, just to remind everybody, we're going to have a tentative second directors meeting. We're looking at probably April. We don't have a date set for that, but Carolyn will be here with us again, and make sure you attend that one as well, because as you guys have learned, this stuff is always changing. So it's another chance for you guys to get clarification on these rules, more thorough explanation. And also please use these TA sessions to make sure that you, especially now that they're going to be citing violations, to make sure you understand what you should be doing and how to do it properly so that you guys don't get violations.
Well, Jamie, Teresa, I don't think I have anything more to add.
All right, so right now I will share the SurveyMonkey then, and I would prefer, this will give you guys a couple minutes to ask questions while you still have Carolyn. I would prefer that you finish this. I'm going to put it in the chat box before you sign off. So I'm going to stop my screen share. Now I can see everybody's faces. I haven't seen that yet. And I'm going to put the SurveyMonkey in the chat box. It's just the usual evaluation that you do after a training. And I will send you your certificates by email. It'll be a PDF attached. And it'll probably take a couple hours for the recording of this to download if you want to share it with any staff or share it with any other administrators that needed this information that weren't able to attend. They just won't be able to get that credit. There's your link. It's in the chat box.
Hey, Teresa, can I ask you, can I ask you a question? I know like it's over, but I have like a random question. Why do the public schools have different requirements, I guess, than we do? Because like we can close down entire classroom centers, but I feel like my kids are going to school and I'm getting letters like constantly.
Well, I do know the last update with the toolkit was an effort to kind of bring them a little closer together.
Okay.
I think a lot of it is the age differences on some of the guidance, you know, their developmental stage for the younger ones. The wearing the mask at age 5 was kind of a big one for them. The older kids can do that a little easier. So I do know that they told us that that was part of it. And I think that's going to be constantly revisited as to some of the things they had initially suggested are not going to work very well for the child cares in some areas. So that's why they said that they would probably be updating these monthly. And they did in December, but I haven't seen a January. So monthly might have been a little ambitious, but I know that.
I got a couple of days.
Yes. Yes. So I do know that they meet continually about this and discuss the issues to try to make them appropriate for the different age groups.
Okay. I know my kids tell me that they sit really far from their friends. So I know they're probably a lot more apt to the 6-foot difference and keeping them separated than like our little people are. But still, I get a letter, you know, with 2 different schools, high school, elementary school, I get them regularly. So just thought I'd ask.
Yes. Yes.
I think thank you guys.
The developmental differences and what works for the young ones, you know, or the older children doesn't work for the young ones but they're trying to bring them a little closer, I think, and a little more uniform if they can.
Okay, cool. Thanks.
You're welcome.
Nice to see you.
It's good to see you today.
And guys, those are good questions to ask when you have questions like that, especially when it comes to like the Play-Doh stuff. You know, when they're making these health and safety guidelines, they're not working in child care. They're really trying their best to do everything they can to meet everybody's needs. So to ask the question about, hey, how do we meet the needs of children that need sensory play? Asking those questions will help them come up with more specific accommodations. So definitely reach out and ask those things when you have a question. And when they make new guidance, they can take that into consideration. They're doing their best to make things safe.
Heather, do you want to ask the question about the nebulizers while we're on here? Because I was just thinking about that.
Why can't you ask it, Cassie?
I mean, I can ask it.
I'm just kidding. So we also read in the, sorry, hold on. My kids are running through here. We're reading in the guidance where we have with our children with special needs, some of them have the option of a puffer inhaler or the nebulizer. And we have quite a few that do much better with a nebulizer because it says it's basically just recommended that they use the nebulizer over the puffer. No, I'm sorry, the other way around, the puffer over the nebulizer. Is it just like we said, a recommendation where we need to do what's best for our little people? Because like we said, we have so many that each child is such individualized care and needs that we need to kind of take that into account. And we're kind of afraid to just go across the board and require everybody to have an inhaler. Did I say that right, Cassie?
Yeah, because we have some children that have special needs that developmentally they're not able to properly take an inhaler, even with a spacer. So what we've done is we've ordered sneeze guards to go in front of them while they're taking a nebulizer treatment. Obviously, we're going to ask parents if they're able to, could they please just do the inhaler? But we didn't know if it was like across the board everybody needs to do inhalers, or if there was if you guys are making guidance and things about that, like for future, maybe that's something else to think about, is our children with special needs are going to really struggle with some of those guidelines.
Right.
Teresa, do you have some feedback for them on that?
I know it was being discussed at our last meeting, and I know the reasoning was the nebulizers would disperse more droplets. But they left it as a recommendation at this point. It's not been, you know, because some children may not be able to do the puffer. If they can, then what we were told is they would want them to do that. But if you have a medical reason that you really cannot change it, the child is going to have the treatment. So at this point, they would prefer you not to if you didn't have to, but they understand there's going to be some children that you're going to have to do it that way. Just be careful and make sure you're taking all of your precautions, because that was the reasoning. The nebulizer spread those droplets more.
Can you think of, like Cassie said, we just purchased the sneeze guard, like shield thing, so that we can set it between the adult and the child receiving the treatment, and just kind of their gloved hand is what's kind of underneath there, making sure that they have their mask on properly. Can you think of anything else that we could maybe do to just make sure that if we have to use the nebulizer, we're using it as safe as possible?
Well, doing the screen's great, because that's going to put your barrier there, and hopefully those little ones or young ones are not going to be sneezing over the barrier. Definitely the gloves, you know, to help protect. Making sure you're doing your hand washing before and your hand washing after, you know, the full 20 seconds, to make sure if you've when you've taken those gloves off, there's no risk of you transmitting droplets. Doing your disinfectant in the area. Are you taking them to a separate room and doing those treatments so that it's just you and the staff doing those? I wouldn't do them around other children if I could avoid it.
Yeah, we haven't had to yet. However, once we have to, we have the those observation rooms between our two classrooms is the perfect spot, because, you know, we have tables and chairs, so we can set ourselves up to be one-on-one and not have to worry about that.
That would be ideal, because you certainly wouldn't want to do it in a room. Want to risk any other child. So using your basic hygiene, you know, as far as the hand washing, disinfecting after, making sure everything's, you know, disposed properly, and doing that separate, you know, from any of the other children, is about as safe as you could be in doing a nebulizer.
Thank you again.
You're welcome. I'll let you know if there's any changes on that. That was the last that we discussed.
Thank you. I know we try to keep up and we try to read everything. And then, of course, with so many of us, we all are like, did you read it that way? I think I read it that way.
Exactly. It's been an interesting year. A lot of changes for everybody.
Jeannie, you're on mute.
"10 months of this and I'm still doing that." I think we're all still doing that. So I have everybody's Survey Monkey in. Thank you very much for doing those. Those are important for me. I don't see any more questions in the chat box. Someone asked about having a similar session for staff. So if they come to the TA session, any staff member can, we can cover this guidance, like do an overview of the guidance, and then people can have their questions. I mean, I can even, I know that teachers are not getting these emails, and cooks and any kind of support staff. They're not getting this information quite as frequently as administrators. So it is good to go over it with staff as well, for them to be able to get clarification too, because they probably have questions too. So just know that when I send out the links for the TA sessions, that is for anybody to come. That's not just for directors. And then they'll have a chance to talk with Carolyn themselves and ask questions.
And Jamie, we're recording this, so staff have access to this as well, correct?
Yep. They won't get credit hours for it, but this can be shared.
And Jamie, whoever had asked that question too, if at any time there is a program out there that feels that their staff would benefit a review of this toolkit, if they reach out to me, we can set up have a Zoom TA session as well.
And for me, that's it. If you guys need anything else.
Well, I just want to thank everyone again for taking the time to meet with us today, and I hope it was beneficial for everyone. And thank you, Teresa and Jamie, again.
Oh, you're welcome. Thank you, Jamie, for setting everything up for us.
And we'll look forward to doing it again in April, and hopefully then we'll have some more positive news.
Yes, we will have positive news.
Okay, I like that attitude, Jamie. We'll go with that one.
Yeah. All right, you guys are free.
Have a great afternoon, everyone. Thank you.
Bye-bye.